Dr. Tumwesigye Kenneth. Call me Dr. TK. I am an obstetrician and gynecologist at Urinary Track Hospital. Today I also want to teach the community and talk about urinary tract infections in general. What are urinary tract infections? These are bacterial, fungal infections that affect the genital tract system, and this condition affects both women and men, adult and children. Commonly, the most causes are related with bacteria, but we can also have fungal infections. And who is at risk of getting urinary tract infections? From my expertise, I should say that everyone is at risk of urinary tract infections, but there are those who have a high risk. We talk of pregnant mothers having a risk for infections or urinary tract infections. We talk of people who have multiple sexual partners, because some of these are sexually transmitted. You could have one faithful partner, but then your partner has another partner. So that is very important and crucial. We also have people who have poor immune systems, people with conditions that affect their immunity system, and it depresses or it reduces. For instance, people who are diabetics, people with high blood sugars. Pregnant mothers also fall in that category, but also if somebody is taking medication that actually weakens their immunity. People who are HIV infected, if they don't take their medication very well, their immunity at the end of the day becomes weakened and they are predisposed to these infections. Okay? So those are people who have risk. How do we, or how can we avoid having or getting infected with urinary tract infections? Number one, like I've said, the most people who are at risk, let us boost our immunity. And how do we boost our immunity? We eat well, a balanced diet. We take a lot of water. We advise our patients or our clients to take a lot of water, such that they keep emptying their bladder systems, and this helps to improve. They should eat a balanced diet altogether to boost their immunity system. And one of the things that is actually making this infection on the rise is what we call off-the-counter self-medication, whereby somebody feels a discomfort in their private part and they go to a pharmacy and buy an antibiotic. The misuse of antibiotics in our community has led to infections that are resistant. You take the drug, but it doesn't work on you. And that is what has led to the rise of these infections. So I want to encourage everybody watching and listening, when you feel a discomfort, I advise you go to the health facility, seek medical care, see the doctor, and they will prescribe or recommend an appropriate drug. That said and done, here at Urinary General Referral Hospital, we are available to see the clients, and we have capacity to diagnose and manage the urinary tract infections. About 10 years ago or 5 years ago, was this a common case? Yes, it was there. However, not as rampant as we can see it today. In my earlier talk, I have said we have misused antibiotics. Drugs that would have helped us to treat this condition, we have misused them. And what has led to the rise in the recent times is the antibiotic resistance. Drugs are no longer able to work on the simple infections, and that has led to the rise in this condition. And in our communities, where people don't have like access to proper medication, then they end up misusing these drugs. Right now, the other thing you can say is that we have the capacity to test and treat. So we are able to detect early and treat, and we hope if we use the drugs very well, we shall be able to curb this problem which is on the rise. If you ask me how often we get these cases in our facility, we run our clinics here every day, and the common test that we do to diagnose urinary tract infections and probably women with discharges, we do a urinalysis or a urinary test, but we also collect the discharges that could be coming out of the private parts for testing. And when we have tested, what do we commonly find? We find bacteria that is cross-cutting. I may not be specific on that, but bacteria ranging from that is sexually transmitted, our own bacteria that would otherwise be normal on our skin, but finding its way in private parts or in the urinary tract systems, causing infection there, is on the rise. And that points us to what I talked about earlier, as the immunity of the body being weak so that it attacks its own, or if there is a contamination from, for instance, from the anal area into the private part, that leads to the rise. And at the facility here, we are able to do different tests to determine which bacteria it is and give the respective treatment. How long can you detect that you have a urinary tract infections? I'll answer that by spelling out what you can look out for, or what are the symptoms of a urinary tract infections. Generally, we have urinary frequency. You find yourself going to pass urine more than usual. You can have pain when you're passing urine. This pain could be at the beginning when you're starting, or at the end when you're finishing. And some men and women will come with discharges coming out of their private parts. But also, if this infection has gone up to this other part of the system, you will find that you have lower abdominal pain, which literally affects the bladder. And if it has complicated, you get general abdominal pain, whereby the kidneys can also be affected. So these symptoms appear depending on the possible causative organism. If it is sexually transmitted, there is usually a history of having had unprotected sex with a partner that you're not related to in terms of this is not your usual partner. And usually the first symptoms can appear in 3 to 5 days, and sometimes we can have high temperatures as a sign. When you go to hospital, you'll have a high temperature with the other signs, and then when the doctors examine, they will notice that you have abdominal pain, and then they will be able to take off a discharge. This can happen depending on which bacteria is causing the problem, but generally speaking, 3 to 5 days somebody has had symptoms, and if they were to come to the hospital, we would be able to test and diagnose early in time before it becomes a complicated problem. How fast do men get the symptoms? I earlier said that everybody is at risk, but this question is specific. Men do get the signs and they also get the symptoms, but compared to the women, men don't have good health-seeking habits. Us as men, we tend to soldier pain, and when you get pain, we overlook it. So the same time period that any other person gets the symptom in the same period that men also get these symptoms. The only challenge with us, the men, we take things lightly. And at this point, I would want to encourage my fellow men that if you have any discomfort in your private parts, do not say this is something minor. I will go to a pharmacy and buy Panadol. I'll go and buy a drug. I'll go and ask a drug. Kindly come to hospital so that we are able to test and confirm what exactly is causing the pain in the private part. I talked about the young and adult, but to be more specific, I want to talk about the common terminology, or saying that why the young girls, why the teenagers who are in school, they are not sexually active, but they commonly get urinary tract infections. This is purely, or most of the times from my experience over time, I have noticed that the young girls and the young babies, the girls specifically, do get urinary tract infections or vaginal discharges from hygiene-related issues. We need to teach our young ladies on how to take care of themselves if they are in boarding schools, but also the schools, we call them the matrons, have a very big role that they play to help the young girls in terms of their hygiene. But also, as young girls and teenagers, they have just started a period whereby they go through their menstrual periods, and this calls for hygiene to be paramount. Now we need to teach the young girls on how to take care of themselves during this period of the month. In that way, we improve their hygiene, we improve their immunity, such that they avoid or prevent getting these common urinary tract infections that are not sexually related. Thank you.